Thank you very much for joining our first health security dialogue hosted by Global Health Innovation Policy Program at GRIPS. And we're privileged to welcome a distinguished guest from Washington, D.C. today, Dr. J. Stephen Morrison from Center for Strategic Studies, Strategic International Studies. In this important timing, we're experiencing third wave of COVID-19 and still face unforeseeable future today. The purpose of this dialogue is to build a community for sharing knowledge and experience and to discuss how to best prepare for future health crisis and build health resilience. In the past weeks, we have witnessed US presidential election, and President-elect Mr. Biden has already set COVID-19 advisory team to deal with the crisis, and also appointed Mr. Ron Klain for White House Chief of Staff, who once Ebola czar in 2014, 2015. So we asked Dr. Morrison to share his views on a US experience and also global health policy under the new US administration. And we have Dr. Kurokawa. He'll be sharing his views afterwards. Then we'll have roundtable discussion and have a Q&A session from audience in the remaining time. So let me introduce speakers from today. For today, Dr. Steve Morrison, who is Senior Vice President of the CSIS and directing Global Health Policy Center from its founding. And previously, he had directed CSIS Africa program, launched HIV/AIDS task force with the Senators John Kerry and Bill Frist. He has directed high-level commissions, including CSIS commissions on strengthening America's health security and women's and family health. He's a frequent voice on the global health, US foreign policy, and international security across the range of media. I would also like to congratulate Steve on successful documentary film series to address global health issues. It's a very new approach and to get attention in this arena. And I strongly recommend you to watch online on CSI's site. Then we have Dr. Kiyoshi Kurokawa from GRIPS. Professor Emeritus. He is directing a Global Health Innovation Policy Program, and he is a member of World Dementia Council and International Scientific Advisory Committee. Previously, he had served as the Dean of Tokai University School of Medicine, the President of Science Council of Japan, the Science Advisor to Prime Minister, a WHO Commissioner, and the executive member of many other national and international professional societies. With that, I'd like to pass the microphone to Dr. Kurokawa for welcoming remark. And then it's going to start. Okay, thanks.
Right. Okay. Welcome all the participants and the audience. I think welcome all of you to this attempt to launch a dialogue with Steve, who is one of the prominent and senior sort of director at CSIS, one of very well-known one of think tanks based in Washington, D.C. We have been working together over the last maybe decade or so on occasion. And I visited there a few times and give some seminars. But now COVID. Now, this influenza began in Wuhan, China, perhaps transmitted from bat. Accordingly, some of the, in this science time, I think that's a decoded sequence suggests something might have happened. There are a few papers on this issue. But anyway, within a week to months, that spread into all over the world and become pandemic. Now, become pandemic means in this hyper-connected digital time, we can follow what's happening in the rest of the world, and also we can watch what kind of response each nation has been sort of implementing and how the top of each nation sending a message to their people, and we can watch this thing. So we could compare the response of each sort of major nations and also the leader, how leader behave and combat against this terrible pandemic in once in a century. So just watch this thing, and I think that's the time we are living right now. So you can, if you do not know, but as you can follow what you want to know through internet. So that is a time which is completely different from, let's say, 100 years ago of big flu pandemic. So let's discuss, let's launch this issue. And I like to make a brief introduction. That means in this time that become pandemic, we had to utilize what to learn from pandemic. And I think there's a frantic effort by every sector of particularly advanced country to deliver, create some vaccine and some medical treatment, and there's a lot of races. And now recently it has been said there's a now vaccine has been tested, seems effective, and how to deliver this vaccine, if it's effective, to the rest of the world. This is another global challenge for all of us. And welcome. All right.
Thank you very much.
Yeah.
It's great to be with all of you today.
Thank you.
And thank you, Kiyoshi. And thank you, Hiromi and Mayumi. And we have partnered on several occasions over the last decade, very productively. And I'm very grateful for the partnerships that we've been able to create over the years. And I look forward to having more. It's very important. The U.S.-Japanese relationship around these issues of global health is quite important. It's been a little disrupted by what's happened. For several years running, we've been having this hosting with the National Academy of Medicine, the U.S.-Japan summit in Washington that's been really quite productive. Keizo Takimi has participated with us on that. And Victor Zhao, the president of the National Academy of Medicine. And we had been looking forward to doing that. And I am expecting we will resume. And I'm expecting that we will resume in partnership with you and doing programs in Tokyo in the future. So thank you so much. Let me say a few words about sort of where we are in the United States before we talk about what may lie ahead with President Biden. What has happened in the United States since early this year with the COVID-19 pandemic has taken everyone by surprise. It's the outcomes are catastrophic. The outcomes are unthinkable. They're indigestible, and they're not over. Let me just give you a few numbers. We have had in the United States, as of today, we've had 11.3 million cases recorded of a total in the globe of 55.5 million. Japan has had a total of 121,000 cases. We've had 11.3 million cases. We picked up 1 million cases in the last week. We've had 248,000 deaths. We're right on the edge of 250,000 deaths. Japan has had 1,895 deaths. That's out of a global total of 1.35 million deaths. It's projected in the United States that we will hit, when we get to the near our inauguration on January 20th, we will have somewhere around 400,000 deaths, 380,000. I mean, the forecasts are different, but we're on a very steep trajectory right now. We're in the middle and the early phases of the winter surge, and the winter surge is not expected to peak until the middle to the end of January, as this gains velocity. So our 7-day average, for the last 7 days is running at about 148,000 cases per day. As I said, Japan for the entire period, 121,000. We're adding on average 148,000 per day. Last Friday, we had 184,000 cases in one day. Our hospital system is nearing the breaking point in many states. I'd say we're nearing the breaking point in probably 2/3 of our states. Today, there are 73,000 people hospitalized in America. And that number has risen very steeply, very, very rapidly. I want to add also a very important factor, which is when this pandemic started in the United States, there was a lot of action taken to create economic measures that would provide a cushion for workers, for small businesses, for large businesses, for a variety of different sectors. And Congress passed 4.5 major legislative measures that amounted to about $3 trillion to stabilize our economy. And at the same time, the Federal Reserve intervened in the marketplace and injected somewhere between 3 and 4 billion. So this was unprecedented. It added about $3.1 trillion to the US national deficit this year. And it had I believe, had a major stabilizing, successful impact. In keeping people, I mean, we had in the end of the first quarter and the second quarter of this year, our economy plummeted. We had 20 million people thrown out of work, et cetera, et cetera. It was very, very dangerous. Our unemployment rose to 12, 13%. Our unemployment's down to below 8% today. 10 million people have gone back to work. Our stock market has been very strong. We've shown a remarkable kind of resilience, but we have not had any additional stimulus measures since April. We've been stuck in a gridlock, largely stuck around the electoral cycle that we've been in. And what that means is that we're in the middle of a surge. We're moving towards outcomes that are destabilizing, that are rapidly motivating the leadership at the state level to intervene and reverse their positions and begin to impose stiff measures of restrictions on people and businesses and schools, and mobility and ability to travel and move around and the like. And that trigger is not different from what we saw 3 or 4 weeks ago in Europe. But what's different in the United States is that we have governors who were very resistant to masking, very resistant to, on ideological grounds, to social distancing, very resistant to restrictive measures that are quickly converting to this in desperation because their health systems are at risk of breaking. When I say breaking, I mean no more ICU beds or no more staff for ICU units. In one state in the upper Midwest, I won't say which state, in one state in the Midwest this weekend reported that it had moved from having one skilled ICU nurse per ICU patient to one for every 6 patients. That's the staffing problem that we face across multiple states. So we're moving towards a state by state, municipality by municipality change. Philadelphia today imposed very strict lockdown measures. So it's a patchwork. It's a rolling process. And keep in mind that one of the astonishing realities is that our federal government is absent from this debate. The White House task force on coronavirus has been missing in action for several months and doesn't function. So we've had a federal government at the level of the presidency and the White House that has abdicated the stage since late April. And so we're not getting much in the way of support against this. And so leadership and responsibility and is in the hands of governors and mayors and local leaders and the like. Now there's one very notable exception to what I just said, which is how the government has organized itself around accelerating the development of vaccines and therapies. In this case, the White House launched Operation Warp Speed back in April and formally in May. And it is a partnership between HHS, Health and Human Services Department, and the Department of Defense, but it also brings in a bunch of other industrial vaccine developer partners. It has put out $10 billion of financing to 6 major vaccine options under 6 different firms. And it has had a kind of concentrated authority in the ability to do this. It's also working on therapies as well as vaccines, and it's working on the logistics of the delivery, of the procurement, manufacturing, and delivery of vaccines. And while the verdict is still not out on all of this, I think there's considerable optimism and hope around this. On the response side, there's plenty of reason for despair, disgust, anger, frustration, and shame, because we have had a colossal national failure, and we're going to have several 100,000 more people die needlessly. On the case of the vaccine, there's cause for optimism. And it has been, Operation Warp Speed has been able to operate with relative lack of interference from the White House. It's been respected generally in that role. It's not been particularly transparent, but it has made some good choices, it seems, in the vaccines that have been developed. Monsef Salawi and General Perna, who lead this, have been much more forthcoming recently in speaking to the public, and they have followed the scientific protocols. They have called upon the FDA advisory committees to make judgments around the vaccines. They have not crumbled to political pressure to accelerate things beyond the normal pace, and that's paid off with public respect for them, and they have not been subject to the same sort of harsh criticism that the White House has faced for almost every other facet of the response. So we have 6 major partners, 2 of them, which are both developing what are called the messenger RNA vaccines. That's sliver of a genetic code wrapped in a little blanket of fat that goes in and stimulates. It's an experimental new vaccine. Both Pfizer and Moderna have come forward with their phase 3 data through press releases. We have not had the actual published data in a journal, in a jury journal. It's been a press release, but the numbers that they claim, 90% efficacy, 94% efficacy for Moderna, 90% for Pfizer, those are extremely impressive numbers. They've got people's hope up, and they are applying for what is called emergency use authorization from the Food and Drug Administration. Once that is in place, we will move into a phase next month in December of beginning to vaccinate, and we will begin vaccinating select targeted priority populations, health workers in particular who are caring for the elderly, those who are the elderly, those who have underlying chronic conditions. The general expectation is that that we will see an acceleration of vaccination in the United States in Q2 and Q3 of 2021. The process will carry forward over the course of the year, but we will hopefully achieve something approaching herd immunity by the end of the year. And by herd immunity, what does that mean? 70% perhaps coverage, 2 doses, so 328 million people in America, 70% of that population vaccinated twice. We do not know what the immunity is that these vaccines confer. That's still an open question. How long does it last? Do people need to be vaccinated every year, every 3 years, every 5 years, just once? We don't know. We don't know how these vaccines will do with children. That hasn't been explored scientifically. That's still a big unknown. So we need to get to the bottom of that. That's not unusual that we have a vaccine developed and children are left till a later phase after adults have been examined. One thing that is a big concern in America is the collapse, this very precipitous decline in public trust and confidence in public health officials, in the White House, and in science and scientific organizations. That's been documented by our survey organizations, Kaiser Family Foundation, Pew, and others. It's been a very sharp decline since March and April of this year. In March and April, when we went into a half-baked lockdown that was about 50% of what was required, was lifted prematurely, there was a very strong sense of national purpose and consensus within America. And the pollsters were shocked at how high that consensus was. It was running at 80, 85%. But then we had premature reopening. We had a rebound, a radical rebound of this pandemic in July and August. There was a bit of a subsidence, and then we had the third wave that we're in right now that is in takeoff mode begin. And in the course of that period, we had our country move into a highly polarized country in which masking became politicized, social distancing became politicized, staying away from congregational gatherings became politicized, and our country became cleaved in two, to the point where today 50% of our population says they will not take a vaccine if put on offer, a vaccine verified to be safe and effective, and in which we have half of our population doubting the seriousness of this pandemic and doubting the wisdom of the science surrounding it, and the other half taking the opposite view, but both of those two sides of our country drawing its information from two completely different sets of sources on the internet or wherever in the media. So we are a country divided. We are a country with an erosion of trust in vaccine science, the White House, public health authorities. We've had direct assaults upon FDA, CDC, and EPA that has driven down their standing within the public. So we're in a very fragile condition right now that calls into question, how are we going to rebuild trust and confidence? And then we have a infodemic. We have a polluted digital media, which is spreading falsehoods, conspiracy theories, echoing some of what comes out of the White House, and stoking confusion. And so the public finds little in the way of consolation when it looks for answers to these fundamental questions. The communications that have been coming out of the federal level have been confused and incoherent, contradictory and full of falsehoods. And then we have this polluted digital environment. So we have a considerable mess on our hands. Now, how do we explain this astonishing outcome? That is something that historians are going to spend many years trying to unpack. and we're still in the middle of it. So let me just say a few words about what I think some of the major vectors are. First and foremost, leadership. The leadership of President Trump stands at the center of these outcomes. There's no denying that. Second factor, political culture. We have been shocked at the level to which masking and these other things become politicized around issues of libertarianism, freedom, individual freedom, et cetera, and the whole question of protection of community and shared risk gets lost in all of this, and we become deeply divided in that period. We have systematic weaknesses in our public health system. We have neglected our public health system for years. It's 3,000 different jurisdictions. It's a rickety system. It's underfinanced and it's understaffed. We have terrible disparities in our society. People of color, Latinx, Native Americans, and people in poverty, regardless of what color their skin is, are exceedingly vulnerable to this sort of pandemic and exceedingly unplugged from the health system or any other protections. And that's been a shocking realization, to see the level at which this has torn through our system. I would add also that the way we care for our elderly in our nursing homes is scandalous. 40% of the deaths are happening in nursing homes with inadequate infection control, basic sanitation.
Right.
The last thing I'd mention is, keep in mind, we have not, by contrast with Asian countries, which went through a searing historical experience with pandemics. Just look at what happened in the responses in Taiwan, in South Korea, in Hong Kong, Singapore, in the aftermath of SARS, MERS, pandemic flu and the like. There was a national decision taken in those countries to take global health security seriously, to build a popular consensus around what that meant in terms of building systems and building public support for compliance and cooperation within that. The United States has not had that searing historical experience. It has it now, and I think it's going to change behavior for a very long period of time. Now, let me just say a few words about President Biden and the Biden administration. First of all, we are in a very fraught and uncertain period. We've had no concession from President Trump, and no admission of defeat, no acknowledgement of Biden's victory, and the process of transition is held up. It's paralyzed and stalled as we wait for this. So that has, as we've heard, that's greatly imperiled the ability to sync up the transition team working on COVID-19 with the Operation Warp Speed and with others within government to understand what's ongoing and to plan accordingly. So we've been blocked from that as a country for 2 weeks. Now, if we get this resolved fairly soon, I think we can recover and move forward. But as I've said, we're in the middle of a runaway, raging disaster. And so we don't have a whole lot of time to fool around. But we're paralyzed right now. So what are the choices that President-elect Biden has? Well, they're all being revealed, right? I mean, he announced on Monday, he rolled out last week he rolled out his task force, the COVID-19 task force, a very reputable group, I think 13 members, a very impressive group of folks. And he has put forward his website, his transition website, buildbackbetter.com, and it has 4 sectors. It has COVID, economic, response, racial justice, climate change. And that's getting filled in. And that you can go there and see the kind of commitments they're making for the next period. What the Biden government is promising is that there will be a national plan. There will be the restoration of national leadership. It will put a heavy focus on testing and expanded testing capacity. It will have an international dimension of leadership that's been absent in this period. It will focus on building local capacities. It will restore the dignity and respect for science and and it will rejuvenate the key public health institutions and the like. And so it will have a coherence, a consistency, and a science-based approach. And it's, as far as I can tell in watching and listening to the pronouncements, it's being put forward in a somewhat calm fashion. In other words, the hope is that people of common sense across the political divide will listen to this and realize that this is not a partisan Jeremiad. This is dealing with a crisis unlike anything we've seen since World War II. And it's being done in a calm and poised fashion. And hopefully people will calm down and they'll begin to come to their senses. Another thing I want to mention here is in the midst of this crisis, we're seeing governors out in the West, in the Midwest, who have fought against masking mandates, fought against social distancing, are having midnight conversions. And that's a good thing. And they should be applauded for that, because it shows that at least we're cracking the code and moving beyond this ideological politicization into acknowledging that we need the tools. We need every tool that we can find here in order to break transmission. And in the current situation in America, as I said, we're running 148,000 average over the last 7 days. We hit 184,000 last Friday. 50% of the infections, we have no idea where they came from. No idea where they came from. Contact tracing is useless in this sort of rampaging pandemic. And so we've got to come to our senses and start thinking about this and dealing with this. Now, it's not going to be easy. Many of the things that Biden is calling for are going to cost money, and no one's costed these out very well. There's some very good reporting in the Wall Street Journal and the New York Times and Financial Times and about these, and that adds up some of the costs of, well, what would the national testing program look like? And the subsidies that are going to be required. And we know that there's an urgent need to get another stimulus bill in that can provide a cushion for people who are unemployed or businesses that are imperiled of going under, and all of that. And that's going to be very expensive. And we know that the national vote on November 3rd was not a resounding defeat of Trumpism. Trump was defeated. Right. Trump was defeated by almost 4% and by almost 6 million votes. But the Republican vote was 5 million above what President Trump achieved in 2016. So it's not a resounding mandate. It's not a resounding defeat of Trumpism per se. And in fact, in the House of Representatives, there was a gain of seats. And in the Senate, many of the key Republican seats that were in play, the Republicans won. And so we're heading into a situation where we're very divided in that regard. And so there's a lot of speculation around, well, are we heading into a gridlock or not? Will it be possible to get a national plan together that will have us investing 60, 70, $100 billion in a recovery program. And when we talk about the national effort, international effort of becoming part of the ACT accelerator, becoming part of, within that, becoming part of the vaccine facility, the COVAX vaccine facility. Up to now, on the international side, we have not joined COVAX or the ACT accelerator. We've not made no commitments to that. We have severed our relationship with the WHO. We've set in motion the termination of that. So there's a lot of international engagement work. There's a lot of work to be done in terms of rejuvenating American diplomatic engagement. And frankly, I think that is going to be something that where there's going to be a welcome to the United States coming back to engage in support of things like the COVAX facility, the ACT accelerator, with cash and with dosage, with vaccine dosage contributions. The United States, under its $10 billion Operation Warp Speed program, it has overspent in the forward purchasing of doses by these different six different candidates that we have supported, and many of them are looking very promising. And so we could find ourselves in the next year, 2 years, 3 years, we could find ourselves with very feasible, safe and effective vaccines with very large surpluses. And that will be very important for the United States in trying to address the big fear that exists internationally, that low and middle income countries will not have affordable access in a timely way to safe and effective vaccines. And so the United States is going to, I believe, come back to the table. We'll see how that plays out. There's a lot of talk about the competition with the Chinese, with the Russians, and we can talk a little bit more about that. The Chinese have 4 promising inactivated virus vaccines that are moving ahead. They've begun vaccinating. 3 of them they've declared are safe and effective. There's no scientific evidence that's been provided up to now. There's been no formal phase 3 trials. There's some trials going on, but there's a big question mark hanging over that. China wants to join the ACT accelerator. It wants some legitimacy. It's doing field trials outside of its country in a number of places. It's marketing its vaccines as an aggressive foreign policy tool, and we'll see what happens. Russia claims that it has a safe, August 14th, it claimed it had a safe and effective vaccine with no evidence. It mobilized all arms of its government around that. It's begun developing relationships outside of Russia, doing some field trials, promising dosages and the like. We'll see. We'll see if, in both cases, cutting corners and not doing phase 3 field trials and not being transparent and not publishing that data is going to lead to some blockages in many parts of the country, but it may not lead to blockages in other places that may feel desperate and left out and take a risk or take it on and hope for the best. And who knows, we may find that some of these are actually very good and safe and effective. Others may turn out to be dangerous. We don't know, but they're moving ahead with putting them in people's arms. So I'm going to stop there. I know time's limited. I've talked too long. I apologize, but thank you for your patience.
Okay, thank you very much, Steve. So Dr. Kurka, maybe you would like to make a brief comment and then go to the round of discussion. Okay?
But I think, on behalf of all the audience listening to this, joining this session, I really appreciate Steve's, it's long, but I think it's a very meaningful and excellent overview and the current issue, past what's happened. And I think I really appreciate your more like global view from Washington, not necessarily from Washington, but I think you really summarized very well in the situation and political and also scientific side of this pandemic. Thank you. So I make a few comments, I think, on this issue. One is, fortunately or unfortunately, this become pandemic. And this digitally connected world, everybody see what kind of thing each nation and leaders are taking. And I think that is a test of leadership of each country. And I think right now, many people read local media, usually because language is different, but I think media would become a very important sort of venue to see their own views, fairly unbiased view, I hope, how the leaders of each countries and also international collaboration has been going on to give some hope to your public. I think somehow Japanese mindset, because I thought this is quite similar to what happened in Fukushima nuclear accident, which is also very relevant to the global affairs, because 10 years ago, that was 10 years ago, like next March, we will be celebrating or marking the 10th year of Fukushima disaster, right? And so that this is a similar incidents, because both become very important global issues, because at that time there are 440 nuclear plants in the world, and that happened in Japan was a very critical message, because Japan had been regarded as one of the best nation with excellent engineering and science and technology, and that happened, right? And so that, but what we fear was radioactivity, which you cannot see. But same with this virus, we cannot see. And somehow, when some accident, major sort of world relevant to the world, and that is sort of in my sort of smallish view, when something happens which things is not visible, Japanese leadership tend to paralyzed. And that was a message in this Fukushima thing. And somebody quoted my message as the same in this virus, which we cannot see. And somehow many responsible individuals, be it political or government or corporate, when we don't see, we cannot see, somehow they are paralyzed what to do. And that appeared in Washington Post, quoting my report in Fukushima. I felt that way too. So I right away just contacted some of the senior civil servants in Kasumigaseki, what kind of thing we should do and this and that. And because I was following what's happening in Wuhan in January through February. And I was sort of expecting it to be coming to either from Korean Peninsula or Japan. And China, in my view, I think they are quite open to what they are doing through the internet, and also many scientists there are sending many publications in English, which I was very sort of impressed by the response at that time. But when I expected it to be coming sometime, and remembering year 2009, that was the Mexican flu. That was a flu epidemic thing, a scare on this thing. And when Mexican swine flu happened, that's the year 2009. And there's news coming out. It's coming out to Washington, D.C. area. And that time, I was right in your institution. And then after 2 days in Washington, D.C., I checked my website, the homepage. Then I have to move to Toronto for 2 days. And then the news in Washington, D.C. came that flu, and Mexican flu swine flu is going up towards Toronto somehow. So when I flew back from Toronto to Narita, direct flight, everybody in the airplane had to be asked to stay there inside and they check all the fever of all the things. So just it came back to me. I checked my homepage. That's exactly the time I visited Washington, D.C. and Toronto, back in Narita. So that's 10 years later again, it came. So that I think I learned a lot from China, and I was prepared to catch somebody. I'm sure Japanese government to catch somebody who are back from Wuhan area or somewhere at the airport. And I'm sure they will do the same thing to identify somebody who may carry this virus from Wuhan area. But completely unexpected thing was Diamond Princess. That carries more than 7,000 people on the vessel. So that was completely unexpected incident to me. And that's the beginning of kind of havoc in Japan. And that's the beginning in this coronavirus epidemic in Japan started. So we couldn't identify somebody who would carry this from Wuhan, the first person, because of not, it was a big vessel, not the airport. Oh. My reflection, and then I was following this thing, and now I'm running one committee under Minister on Corona Measure, Mr. Nishimura, who is a very competent politician with a good background. So just I'm working on this issue right now, what to do and how to reflect what Japan has done.
Yes.
So I really like to just restart again some of this collaborative work with you guys, because American response was, as you said, was a bit disastrous.
Thank you. May I respond to just a few of the things points that you made?
Yeah.
Which are very interesting. I mean, I think the Fukushima comparison is a very, very powerful comparison.
Yeah.
I think, I remember coming and doing programs with you in Fukushima during, in the aftermath of the March 11th, 2011, a great earthquake. And I remember you came to CSIS and presented the findings of the diet commission that you co-chaired, which was profound. And so I do think that those are apt. And in America, there's a lot of discussion right now around should we have a 9/11 commission? Because after 9/11, people were in shock. They wanted to know the root causes and what to change.
Yes.
And it was regarded as a reasonably successful effort.
Yes.
And so there's a debate underway right now. And of course, we're so polarized. We have such a terrible climate at the moment. It may be hard to move ahead, but it's not impossible. And there are Republicans who are in support of this idea. But it's going to have to be done very carefully if we're going to do anything in this regard. It can't be seen as vengeful. It can't be seen as partisan. It has to be seen as something that's above that. And, and so I'm hopeful that we will eventually see something like that. I think it's going to be important for clearing the air, for understanding what we missed and how we wound up in this situation that we're in and what we're going to need to do to fix this. The leadership issue you rose about, you mentioned leadership. The pandemic is a test of leadership, and that's absolutely true. And in the void that was created by the abdication of leadership responsibility at the national level, we saw a lot of things happen that were very positive. We saw a lot of leadership at the governor level by Republicans and Democrats. We see coalitions forming. We've seen a lot of leadership at the mayor level, and we've seen a lot of leadership at the by foundations. The Rockefeller Foundation jumped forward, put $100 million into promoting a national testing program.
Right. Mm.
And has formed up with that coalition of governors and others and had dramatic impact in the
Right.
thinking and planning around testing. So we've seen that philanthropies in the midst of this kind of
Yeah.
crisis have a huge role
Right.
to play. Universities, interestingly, universities faced this challenge of all of these students coming back and not clear how do you control on this. And universities became great innovators under enormous pressure on the testing front in particular. It's not always been successful, but there's a number that have really pioneered the testing protocols and provisions, and they've drawn deeply upon their lab capacities and other things. So there's a bunch of very good stories out there where you've seen leadership and you've seen response, and it's not going to stop as a major important thing. I want to mention one other thing. There's a question from one of the audience members.
Yeah.
Keito Watanabe asked a question. Very interesting question. Very interesting question. President Trump did very, very well in a number of states where the pandemic was at its hottest point, where it was out of control, and yet they didn't suffer in some states where that was the case, did not suffer a penalty.
Right.
I think, and this is I think there was a sense going into these elections that there would be a repudiation of Trump because of this performance across the board, and there would, and that did not happen. And we have to ask ourselves why. And I'm not sure we have very good explanations up to this point.
I see.
I do think that the economy, the economy bounced back after a sharp decline in the spring. As I said earlier, our unemployment down to 8%. The stimulus measures reasonably successful, and then the president's message, which was, don't take this seriously. This is not that serious a threat, and we're going to be past it soon. And when we are past it, the economy is going to rebound. And people were, I think, a good measure of support for the president had to do with his performance, his perceived performance pre-COVID in the management of the economy, because the economy was going quite strong. And so I think that's important. But I also want to say that there's two other things. One is, I think the pandemic and the performance by Trump on the pandemic was absolutely decisive in Biden winning. I don't think there's any question. I don't think there's any question that the turnout among populations that were exceedingly vulnerable was off the charts. The change of attitude and behavior and voting patterns among suburban Republicans was radical and profound, and tied by all polls, tied directly to this issue of the catastrophe that had happened. The other thing I want to mention is that, don't underestimate the power of media and propaganda in this. I mean, last weekend we had in Washington, D.C., we had, I don't know what number, 10,000. It wasn't a huge number, but we had people in the streets going up to the Supreme Court, claiming that that the election results were somehow false, and clinging to those ideas, and persuaded that this was a righteous cause, and that is continuing as a theme, and it's an indicator in my mind of the durability of sentiment to deny that this pandemic is as serious as it is. And so we do face this problem of people suffering massively, 250,000 dead, 10 point, whatever I said earlier, 10.3 million, 10.7 million And yet there's still an ability to not take this seriously, and to claim that it's really not that big a problem and it's going to go away. So I think we all puzzle over that, understanding that and understanding what to do about it. Thank you.
Yeah. Okay. Just like I like to make a comment. I think mortality rate in the US was terrible. I think New York City and all the things, but I think Japan did very well. And I think that is not necessarily a sort of government, but sort of Japanese sort of mindset, maybe reflecting maybe post-war area time, because tuberculosis was number one killer in Japan. Because almost everybody has tuberculosis. I did. And I was hospitalized for a few months, I think even back again when I was in college. So that is a sort of inherited in mindset of Japanese. And the impact, Washington Post wrote this thing. This is sort of Japanese mindset is really one of the success of this corona issue. But also another issue why Japan did very well and also mortality rate was very low was maybe just Japanese mindset. You can go to medical clinic just anytime. I mean, yes, you have access all the time because this is a sort of everybody covered by public health services and medical bill. Out of pocket is very small. And you usually have a nearby clinic. You can go almost any time. That's one of the issues, easy access. In the US, it's very hard to think to go to see doctors because always there's a cost, I think. Even in my view, when I was in Los Angeles, in the US, if something happened to me, there's a mind sort of psychological barrier to go to see doctors usually because there's a bill and this and that. So that is the mindset was one of the factors in Japan. Also, I think Japan, that's a customary, they always wear the masks during winter and cough. And I think I knew many non-Japanese visitors during winter in maybe in the car or train or wherever, many people just wearing masks. And they are kind of scared to see many people working in the station and other places wearing masks, which is a sign of something bad happening in this person. And so that is a custom in Japan. So that was one reason why the Japanese sort of outcome has been pretty good in this context. That's a part of Japanese psyche and custom, which looks quite strange. Somebody visiting Japan in winter and taking a metro, this and that, everybody wearing mask.
Yes.
And they're scared. Something happening?
Yeah.
Yeah.
Well, and it is a cultural, there is a cultural meaning, a cultural signature to mask wearing, and and it doesn't change overnight.
Right.
And it requires a sort of patience and deliberate sort of approach.
Right.
Of setting examples and bringing the temperature down.
Right.
And I don't think that pointing fingers and getting into confrontations works in these sort of settings. There is going to be more mandatory action taken by, as we've seen every day. There are Republican governors now coming forward with mandatory mask actions that were unthinkable 2 weeks ago or 2 days ago. So maybe that begins to change culture and experience if people begin to feel that this is protecting them and their families and their communities.
That's the history of Japan too, right? That's a history, I think, historical memory built in Japan. Yeah.
Yeah. And so we are going through this searing historical experience. And we will learn from that.
Right. But at least I think this is a global world and the infections and also digital connected area. So we could share who are doing what kind of things. And that really expose the leadership of each countries because it's become pandemic.
Yes.
Yeah. So like sharing the data and some wisdom and leadership That is a big lesson for all of us.
Thank you.
Because usually media is a sort of media, but I think now in the internet, everybody knows who is doing what.
Thank you very much. It was very good discussion. We really like to continue, but we came to a time limit.
Okay.
So maybe we can continue in the future session with having more, learned lessons to exchange both countries' experience. And we hope that, for the next U.S. administration with Mr. Biden, with strong commitment to global health policy, so that we hope that U.S. again becoming a leader in this field and want to see the, strong leadership there. And we have done, U.S.-Japan comparison study with the CSIS in the past. So we hope that we could continue some of the, those potential studies and then areas of collaboration between Japan and US. So thank you very much.
But in that regard, I think Prime Minister Abe did a good decision, but not the result. See what happens with Suga-san.
Great, yeah.
That's what you're saying, right? Okay.
I'll look forward to the Mr. Biden sitting up his team, and I hope to see more proactive measure to this COVID-19 crisis. With that,
right.
Thank you very much, Steve. Thank you very much, Kurokawa Sensei. And we are going to have a series of discussions, and then we'll please tune into our GHIPP.
Right.
We'll,
okay.
The future discussions and sessions. Thank you very much for joining.
Okay. All right.
Thank you. Thank you all.
Good to see you, Steve.
Good to see you all.
Back to us. Thank you.